Your body doesn't care about wellness trends. It cares about stress. Ashwagandha, Withania, Sonifero has 3,000 years of use and a growing body of modern research behind it. In the next few minutes, you'll learn what it can help, how it works, how to take it, who should avoid it, and how to fold it into a regular routine. Ashwagandha is an adaptogenic root from Ayurveda. In plain English, adaptogens help your body maintain balance under stress, mental, physical, metabolic, etc. Traditional use focuses on restoring strength, stabilizing sleep, and supporting steady energy without harsh stimulation. How does it work? Cortisol modulation. When stress spikes your cortisol at the wrong times, especially at night, sleep fragments and recovery suffers. Ashwagandha appears to smooth those spikes, supporting calmer evenings and steadier mornings. It's a central nervous system call. It's often described as having a GABA-like calming effect, relaxing focus rather than sedation, antioxidant and anti-inflammatory support. With analytes and other compounds, reduce oxidative stress that can chip away at mood, cognition, and recovery. Endocrine and metabolic effects. Some people show some shifts in thyroid markers and glucose regulation. That's helpful for some. For others, you got to watch out. What can it help with? Stress and sleep. A racing mind at bedtime, early morning cortisol spikes, wired and tired. Focus under load. You need calm clarity, not jittery energy. Training and recovery. Soreness, sleep death, and next day readiness. Mood and cognitive edges. Modest support for anxious mood and memory in small trials. For those with shift work and busy families, it's more predictable wind-down routines without heavy sleep meds. Reminder, this is educational. This is not medical advice. Evidence snapshot. Credibility without the jargon. Human trials are often small but growing, suggest improvements in perceived stress, sleep quality, and recovery metrics when used consistently for several weeks. Early human data also points to modest benefits for focus, memory, and mood. Findings around thyroid and glucose are mixed. Great reason to individualize with your clinician if you have those conditions. Dosing and timing. Standardized extract is 300 to 600 milligrams a day. Look for withanolides listed on the label. Root powder, traditional, is 1 to 5 grams a day in split doses. The timing. Evening if your target is stress and sleep. Morning if your target is to focus, training, and recovery. You want to give it 2 to 4 weeks before judging to see if it works. Benefits are cumulative. Another option is to cycle it. 8 weeks on, 2 weeks off. Some people like the reset. Remember, choose only root products, not leaf blends. Standardized with olefins and that are third-party tested. And transparent labels. Nothing that's hidden in the label. Side effects and who should avoid. Most people tolerate ashwagandha. Possible side effects include GI upset, vivid dreams, or daytime drowsiness at the higher doses. Caution, if you're pregnant or breastfeeding, you have an autoimmune disorder, or take immunosuppressants, have active hyperthyroidism, or take thyroid meds, diabetes or glucose-lowering meds. If you're on lots of medications, we call that polypharmacy. Potential interactions include sedation, thyroid, diabetes, blood pressure medications, immunosuppressants. Anything that you take, you need to talk to a licensed clinician. Smart stacks. This is not medical advice. This is just examples to consider. Sleep stack. Take ashwagandha and magnesium glycinate. Limit the TV. You're going to sleep in a cool, dark room. Cut off the caffeine at noon. A focus stack, take it in the morning. AM, ashwagandha with L-theanine, moderate coffee, deep work blocks. And for recovery, ashwagandha with protein and creatine with hydration, and consider that at bedtime. Realistic expectations, right? For calmer evenings and better wind down, 1 to 2 weeks. For focus and training recovery, about a month. For mood and body edges, 6 to 8 weeks. Let's talk about myths versus facts. Myth, it's a stimulant. Fact, it's an adaptogen. Many feel calmer yet focused. Myth, higher with phenolides equals always better. False. Fact, tolerance and fit matter more than chasing a number. Myth, you'll feel it the first night. Fact, most benefits build over weeks. How to choose a supplement. 30-second buyer's guide. Make sure it's root only on the label. Standardized with thalanines clearly listed. Make sure it's third-party tested. Avoid proprietary blends or hidden stimulants. Reasonable dose per capsule so you can titrate. No mega dosing. If your cortisol peaks late, your brain won't power down. Your mind races, your heart rate stays high, and deep sleep collapses. Evening ashwagandha can flatten that late spike so you can fall asleep faster and stay asleep longer. If your main issue is daytime performance and you already sleep well, push dosing to morning. Some rapid fire questions. Can I take it with coffee? Yes. But if you're anxiety prone, try a PM dose or keep the coffee modest. Do I have to cycle it? It's optional. Many like to cycle for 8 to 12 weeks on and then 2 to 4 weeks off. What if I feel groggy? Lower the dose or move it to earlier in the morning. Can I stack it with melatonin? If needed, keep melatonin at a low dose. Start simple and add slowly. Tool for stress, for sleep, and steady performance. If you respect dosing, quality, and your own context, start slow, stay consistent, and track how you feel for 2 to 4 weeks. If you need help tailoring, bring it to your licensed clinician and personalize it. Call to action. Comment sleep if you want exact PM routine and dosing ranges, or focus for the AM routine. Subscribe to my channel for practical, evidence-aware health and preparedness. This is survival. This is resilience. This is Suburban Prepper. Medical disclaimer. This video is for information and education only. I'm a nurse practitioner, but I'm not your nurse practitioner. This is not medical advice and does not diagnose, treat, cure, or prevent any disease. Do not start, stop, or change any medication, herb, or supplement without talking to your licensed clinician. If you have any concerning symptoms or emergency, seek care immediately.